Focused on uncovering resources for those who are most vulnerable to coronavirus, the Associated Press says more than 20,000 people have died already in nursing homes and long-term care facilities nationwide. A week ago, the president announced a new federal initiative specifically aimed at protecting seniors. We just checked in with the Centers for Medicare and Medicaid Services administrator about where things stand with the new commission on quality and safety in nursing homes.
And this is going to be an independent commission, so CMS will run it, but we'll have another entity actually go through the operations to ensure that its independence.
Administrator Seema Verma says the commission will be focused on looking at what happened inside nursing homes during the pandemic, putting together best practices and recommendations on how to move forward with reopening. The commission will be comprised of facilities, family members, infectious disease specialists, medical ethicists, and others. In terms of supplying facilities with additional PPE supplies and funding, Administrator Verma says they've been doing that all along through FEMA. Another component to the White House's Senior Protection Plan includes facilities reporting cases to the CDC, families, and residents. It's important for transparency and preventing future outbreaks.
But it also really feeds into our overall efforts around surveillance. You've probably heard Dr. Birx talk about sentinel surveillance. And the idea is we want to monitor communities for asymptomatic spread, right? We're going to be focusing that partly in nursing homes because we know that that's a vulnerable population.
We asked about nursing homes and other facilities where larger numbers of residents died. Also, some states putting protections in place to prevent facilities from being sued. Administrator Verma had this to say.
And many nursing homes have had long-standing problems with infection control. It's actually one of the areas that we provide frequent citations. It's been a focus for the agency. So they are required to adhere to these guidelines under the law.
Meanwhile, some nursing homes with high infection rates are facing consequences. The Washington Post obtained this notice from the state of Maryland, fining one facility $10,000 a day until they come into compliance. That facility had 35 deaths.